Preparation for the examination. Given that the majority of the ultrasound examination is to assess the uterus and can be performed with transvaginal approach, it is recommended that the patient presents with an empty bladder. The patient is the best placed in a dorsal lithotomy position with the leg flexed and the perineum at the edge of the table, which allow the manipulation of the transvaginal transducer. The transvaginal transducer is the best introduced under the real-time imaging, and the presence of the chaperone should be considered in accordance with local policy. When the transabdominal ultrasound is performed, the patient bladder should be distended adequately to display the small bowel from the field of view. A written request for the ultrasound examination should be available and should provide sufficient clinical information to allow for the appropriate performance and interpretation of the examination. Some indication of pelvic sonography. The first one is pelvic pain, dysmenorrhea, amenorrhea, menorrhagia, metrorrhagia, metrorrhagia, and follow-up of previous detected abnormalities. Evaluation, monitoring, and the treatment of infertility patients. Delay menses, previous puberty or vaginal bleeding in a pre-puberty child, postmenopausal bleeding, abnormal or technical limited manual pelvic examination, sign or symptoms of pelvic infection, further characterization of the pelvic abnormalities noted on another image study, evaluation of congenital uterine anomalies, excessive bleeding, pain, sign of infection after pelvic surgery or delivery or abortion. Screening for malignancy in patients at increased risk, urinary inconsistent or pelvic organ prolapse. Guideline for intervention or surgical procedure. Some features of normal uterus. The uterus is primarily a muscular organ located in the true pelvis between the urinary bladder anterior and the rectosigmoid colon posterior. The space between the uterus and the rectosigmoid is the posterior called the sac, the most dependent area in the peritoneal cavity where peritoneal fluid tends to accumulate. In the reproductive years, the endometrium is under the influence of sexual hormone and undergo anatomical changes during the woman's menstrual cycle. As described in the section on scanning techniques, the uterus is the first image in its long axis on the mid-sagittal plane, which is obtained by visualizing the long axis of the echogenic endometrium. The mid-sagittal plane allows the visualization of the uterine fundus, a significant section of the myometrium, the endometrium in the sagittal section, the cervix and the sagittal section, the cul-de-sac and retrosigmoid, and the urinary bladder, measuring the length, the depth, and the height of the uterus.